Hi, hello. This is Brian and Christina from Your HealthySteps, and today we are talking about the longest muscle in the human body. And it's got some really unusual pain patterns, and the pain can often go misdiagnosed and cause a lot of problems and a lot of confusion and frustration for some athletes. So a lot of athletes who use this muscle a lot and want it to be healthy are soccer players, basketball players, dancers, but then also runners and swimmers can definitely be affected by this muscle. And it sure gave Brian's client a lot of problems.
Yep, sure did.
Yeah. So what we want to do is just explain a little bit about this muscle. And what we do at Your HealthySteps is we teach foam rolling and self-care skills so you could be active, pain-free, and healthy.
And healthy.
Yes. So we're not medical doctors, and we're not diagnosing, treating, or prescribing. We are sharing experiences from our 14 years as massage therapists, and we have a lot of neat experiences and stories to share.
We do.
Yes. So Brian, he would love to be able to tell you a story of why he lost his voice. It wasn't a great concert
no concert.
Going to the bar at St. Patrick's last night.
No.
He just lost his voice. So he's going to be asking questions today, and I'll be answering them. Okay? Okay, so...
Okay, so let's, I guess we should start with the story.
Yeah. So Brian had this client, and she was a runner, and she was having pain in her knee. And it was starting on the inside of her leg, right by her knee, and she felt like the pain was radiating inside of her knee.
Right.
So she had her knee looked at, and they thought it might be femoral pain syndrome, also known as runner's knee.
Runner's knee, yeah.
Right? And it was recommended that she do an MRI.
Yeah.
But she listened to her gut. She felt that her knee was healthy, and she wanted to do a little bit more digging. And so she went to Brian again, and together they did a little bit more talking. And she said something that, set off a little thought in Brian's head, that she had this burning sensation. It was almost a stinging pain down the inside of her leg. And she thought, well, maybe it had something to do with her groin muscle. And so as Brian started to work on her, he found out that it was the Sartorius muscle. That's the muscle of the week. And this poor lady, she had all 3 trigger points in this one muscle, and that's why she was getting all this crazy pain.
It was pretty bizarre.
Yeah, and no one could figure it out. Okay. So, yes. Did I do a good job?
You did a very good job. So let's tell us about the Sartorius. And again, I apologize for my voice, but tell us a little bit about the Sartorius.
Okay, so the Sartorius is the longest muscle, and it crosses 2 joints. The first is at the hip joint, and then it goes all the way down the upper leg, and it crosses the knee joint. Yes. And
then just a little history about it. I think that's pretty cool.
Oh, yes. Okay, so this muscle is has the Latin word Sartorius, which means tailor, because it's the Latin word, because that's how the tailors sat when they were doing their job. And we'll show you how a tailor sits very soon.
We'll show you here in a minute.
Okay?
I'll demonstrate. So why is this important for athletes and active people?
Just because it has, when it gets tight, it creates unusual types of pain. And then when that pain is not, or when the tightness is not addressed and it causes pain referral patterns, those are unusual pain patterns too. So it leads to pain that is hard to diagnose, which can lead to frustration, like your client was having.
Absolutely. She was very frustrated.
Okay.
So what's the location? So it's all time for me to stand
Brian's going to be we're going to demonstrate on Brian today. Okay, so this muscle starts at your hip. So just like if you put your hand on your hip like Brian is doing, those fingers are resting on the part of your hip that sticks out the most, called the ASIS. That's where the Sartorius attaches, and then it runs down and it attaches to the inside part of your leg just underneath the knee. Yep. Now in that area underneath in the inside part of your knee, there's 2 other muscles that attach there, the groin and the hamstring. So that's an area where there could be lots of issues going on. So it's a problematic area. Okay, so what this muscle does is it does quite a lot. Check this out.
Yeah, it's very,
Okay, so it pulls the leg up at the knee. Okay, it rotates the hip outward. Yes, it pulls the hip away from the center of your body. And it bends the knee and rotates the bent knee inward. Yes. So there you go. Now, if Brian was sitting down, he would be sitting like the Taylors did, right? And that's where this muscle gets its name. But if you're having pain after you sit like this for a while, or if you're having trouble getting into this position, it could mean that your Sartorius needs some attention.
Let's just shift the knees up like this.
Okay.
If it doesn't go all the way down, it's usually a good clue.
Okay.
Yeah.
Wonderful.
So how do they know if it's tight? So how would an average person know how this muscle is tight?
Okay, so number 1 is the position, right?
Yeah.
If it hurts when you get into that position, or if you can't put the leg all the way down. You also know when the muscle is tender to the touch.
Yeah.
So anywhere along that muscle, if it's tender, if you have tightness and pain around the knee or hip joint, if you have a burning sensation just under the skin, you have a stabbing pain anywhere along the inside, along where that muscle runs. If you have pain or swelling on the inside of the knee, or pain or swelling at the hip attachment. Okay, so that's the beginning of it, right?
Yeah, and then what's the trigger point pain patterns?
Right, so if your muscle is tight and you don't address it, then it can create trigger point patterns or pain patterns, which means that it's going to start spreading the pain to other parts of your body. So even though it's the muscle that's tight, you might feel pain in the front of the hip, down the front and to the side of the thigh. That's the first trigger point. The second trigger point or pain pattern is you could have pain in the mid-groin area and to the front of the thigh. And then the third one is it could cause pain along the lower groin area to the inside of your knee. So to me, it almost looks like your whole upper leg, right? It could totally affect your whole upper leg.
Not so much the exact front, but certainly that line.
Yeah.
It can radiate out to the front and under the groins.
Yeah.
Pretty much the whole upper leg. That's a good point. Good point.
Okay.
So what are some other things that can, what are some other problems?
Some other issues. Okay, so this muscle also can entrap a nerve. Like if it gets really tight, it can squeeze on that nerve, and then you might experience pain, tingling, numbness, or burning on the outside of your thigh. And then also sensitivity to a light touch. Yeah,
just having somebody rub their hand, just patting your leg, that would be very painful.
Okay.
Yeah.
And then also high sensitivity to heat.
Yeah. So you were saying like taking a shower would not be fun.
Right.
It would hurt. It would really be tender.
Okay.
Yeah, that's a really good clue.
Yes. Okay.
So again, who is affected by this particular muscle?
Right. So Brian calls it multi-directional sports, right?
Yeah,
so when you're bopping on your legs, going in all these directions. So like soccer players, making quick turns, or dancers, or lacrosse players, or basketball players.
Field hockey. That's another one. Yeah.
Okay. But then also swimmers and gymnasts and runners also can have this muscle get tight and create issues for them. Right. Okay.
What's our free offer?
Okay. So we have for you a free report, a special report that talks all about foam rolling. 4 things no one has ever told you about foam rolling except Brian. And then fantastic tips to help you learn how to use your foam roller more effectively.
Yeah, immediately. Yep.
Yes.
Yep.
So download that free report, and we'll put the attachment right with this video. Okay, and then make sure you follow us on Facebook.
Absolutely.
So you'll get notifications of our next Facebook Live, which is at Mondays at 11 o'clock. Okay.
If anybody finds my voice, let me know.
Okay.
Lost.
Thanks so much.
Have a great day.
Bye-bye.